There are a lot of things that overlapping in these two medicine that I can use for patient. It's kind of like we add one more tool in my toolbox. But the difference is that functional medicine, a lot of time, it does to bring up a lot of scientific research. And in TCM, we are also catching up in its perspective as well. I started as a TCM practitioner about 20 years ago, and I really love it because it doesn't just focus on the illness, it focuses on this person. What does that mean by focusing on this person? It focuses on this person's mental stability, mental health, mental strength, and also the physical strength, stability, and also structure, not just the illness. So for instance, if you get sick, if you get a flu, we focus on what manifests as the flu, because it's not just fever, cough, nasal drainage, but also if the patient also experiences insomnia or anxiety, that means that there's some imbalance in the heart qi. So we treat and bring the balance back to the heart qi as well as helping the body to fight the virus itself. So this is why I like Chinese medicine. And about 5-6 years ago, I started to learn functional medicine is because that there are a lot of things that in common, especially when we are focusing on the condition. We don't talk about just the illness. We talk about how the body manifests. Especially like functional medicine, I apply to my TCM practice is that they look at the predisposed factor, the mediating factor, and the triggering factor, which is a very scientific way to explain the constitution, the pathological change, and also the triggering change in TCM as well. That's why I like to combine these two, and especially the functional medicine that I learned is that they focus on the timeline. Again, focusing on how the pattern was formed in one person, and that can be translated into Chinese medicine, the kind of balance that we're seeing, and correct from that. Functional medicine also like to use natural way to restore the function of the person, which I think it resonates with Chinese medicine. And especially in America, a lot of my patients like the scientific fact or the research that functional medicine has a lot of resource in. So that's also something I like. So when I look at these two medicine, there are a lot of things that overlapping in these two medicine that I can use for patient. It's kind of like we add one more tool in my toolbox. But the difference is that functional medicine, a lot of time, it does to bring up a lot of scientific research. And in TCM, we are also catching up in its perspective as well. I think integrating these two medicine really can bring the most benefit for the patient. Chinese medicine really like to emphasize not just the acupuncture and herb, but emphasize the chronological change of nature and how the body should resonate with the nature. Functional medicine, however, is more of how the bodies handle stress, how we can use nutrition to help to optimize the body's function. So these are the two difference. So when we restore the balance in the person, in TCM, it's more like, oh, how do we feel in spring, in summer, in fall, in winter. So in spring, we need to be more vibrant. In summer, we need to have less heat. In fall, we need to restore the spring qi. In winter, restore and replenish the kidney qi for future use. However, they don't talk about that in functional medicine. It's more of how can we reduce inflammation? How can we detox? How can we use supplement to help with issues that we just talked about? If you like this video, please subscribe and follow me, and I'll see you soon.